John, I think that for a long time, when the seeds for IHCPR, and again, that's Integrative Healthcare Practice Resources, when those seeds were first germinated, I can remember speaking with Dr. Matt Kowalski here in Massachusetts, who fortunately is on the staff at Brigham Women's Hospital, with John Ventura with the Rochester Chiropractic Group. John is on the faculty at Rochester School of Medicine. And by the way, you are on the faculty at Tufts School of Medicine. I totally forgot about that. And Brian Justice, who has practiced in a hospital setting and so on. And it became very clear that there's a need, in our opinion, for a resource that people from the chiropractic community can go to access information that gives them the confidence to go into the integrated setting, to create a more integrated environment, whether they're in practice now or that's the direction that they want to go in. Give me some thoughts on that.
You know, we're lucky. We have individuals that are in a single practice that are they're interested in doing and getting associated with a one-person practice. We, by one-person practice, I mean another practicing medical physician, primary care physician, a family medicine physician. We have individuals that can counsel that individual doctor.
Right. Yeah.
We have an individual in Ian who happens to be working with a hospital. I mean, you don't
Dr.
get
Paskowski.
Dr. Paskowski,
Yeah,
yes.
right.
I mean, you can't get anything better than that in terms of getting the knowledge of how to get involved with a hospital group.
Right.
You have Matt,
Yeah.
who has an interesting. First of all, Matt is just brilliant in what he's able to do, and what he has done in the profession, and the way he's advanced chiropractic in a multidisciplinary setting. He can give us anyone who's interested the input in terms of how to get involved in that type of setting. I happen to be with a group of individuals, mostly primary care physicians. So I guess what I'm saying is, whatever that particular individual wants out there, we have someone in that setting that can give them advice.
And that is true. I think we have a pretty broad spectrum of doctors who've been in practice for as little as 4, 5, 6 years, who've gone on to accomplish some marvelous things. And I would like to think of IHCPR as a resource where you can access a Dr. Danchek, or you can access a Dr. Paskowski, or other chiropractors who have gone on before them to accomplish some rather significant things. And I think that that's our purpose. Our purpose is communicating that to the viewer, that IHCPR really is here to serve a community, to create a greater community, if you will, where we can take the profession to places where it's never been before. That at least is sort of the dream that I have.
Absolutely. Yeah. And it really has nothing to do with narrow scope of practice. It has nothing to do with a particular type of technique.
Right.
Or it has nothing to do, it's multidisciplinary in terms of technique, in terms of skills, and every one of us is patient-centered.
Right. And I think that what you just said, the key of being patient-centered is so critically important, because I think, and I'm probably talking to new graduates or students, you just cannot focus on student debt and the patient at the same time. And if you focus on the patient, if you're patient-centered, if you're values-driven, everything takes care of itself. So.
You're absolutely right. One of the interesting things in being involved with a medical group is to see the way they think, and compared to the way we were brought up in practice and the way we would think. I mean, initially, we had to fight for every patient that we would get.
Absolutely.
They initially had hospital emergency rooms sending patients to them. I mean, when was the last time that an emergency room doctor said, if you don't feel better in 2 days, go and see your chiropractor? It never really happened.
But now there are DCs in emergency rooms.
Just what I was getting ready to see. Now you have DCs in emergency rooms, and
Yeah.
and where I happen to be with Mount Auburn Hospital, we have emergency room doctors when there's soft tissue injuries with saying, hey, if you aren't any better, go ahead and see your chiropractor.
Yeah,
Because
I think that's exciting. John, I really look forward to maybe our doing this again, and maybe we can pick some specific subjects and dialogue on them for the viewers' benefit. So,
I think it'll be fun. I think
Yeah.
it'll be educational.
yeah, I think it would be
I think
good.
it'll be helpful.
All right, thank you, John.
Thank you.
Okay.